Today we had a great honor to join Dr. Sanel Bosch and Dr. Freek Bester with their project to hand over 50 parcels, goodie bags, to the Department of Free State, the COVID task team from the department, for their wonderful efforts they've done in curbing this virus. We were proud to be part of the project, and we thank Dr. Sanel Bosch and Dr. Freek Bester for approaching us to join them, and we hope that the doctors from the Department of Free State Health will enjoy the parcels.
It's something very special when the private health fraternity moves to the public health fraternity in a way of thanksgiving. And what we've realized in working in the private sector is that there's a group of people in the public health sector working round the clock, doing exceptionally hard work to counter the COVID-19 pandemic. And what they are actually doing is they're following up every single positive patient in our province, and in that way try to ensure that everybody in this province stays safe. And that's a huge job that they're doing.
We are part of the surveillance team in the province, and the responsibility of the surveillance team in the province first is to identify all the positive cases. So we get their results and we communicate with them and make sure that they are isolating, they are admitted, they are taken care of. The second responsibility that we do is to do proper contact tracing of all the positive cases. So every person in the province who has been tested positive, we call them and we make sure that we know who they were in contact with. So we have a whole lot of team members who are making sure that every day they follow up on the close contacts, they follow up on the cases to make sure that people have recovered. And that's why we report constantly on the recovered cases.
The idea was to recognize the hours and the hard job that they are doing, and all that while we are sleeping in our beds. These doctors who work here are keeping the Free State safe, and I think they are doing a pretty good job at the moment.
This is a beautiful gesture, and we really appreciate it. Such a surprise for your kindness. It's really appreciated, and I think it's not about private and public healthcare. It's healthcare. We serve one people, and all of these people we serve together. And for this gesture, I think it really inspires people's spirit. And thank you for that. We serve one God, we serve one people, and thank you so much.
You can clap better than that. You can clap better than that. You can clap better than that.